Good day. For today's lesson, we are going to answer the question, how do we take care of our circulatory system? A wide range of diseases can affect the circulatory system. These include dysfunctional conditions of the heart, blood, and blood vessels. For the protection of our health and that of our family, let us learn how some circulatory diseases are prevented, detected, and treated. Such knowledge will guide us on how to take care of our circulatory system. Cardiovascular diseases. Cardio means heart and vascular means blood vessel. Cardio means heart, while vascular refers to blood vessels. Cardiovascular diseases are disorders involving the heart and the blood vessels that carry blood to all body parts. Some of these cardiovascular diseases are described below. Ischemic heart diseases. It refers to inadequate oxygen supply to the heart muscles due to impaired blood flow to the heart. This condition can be generally traced to excessive fat deposits, known as arteriosclerosis, and excessive buildup of plaque, referred to as atherosclerosis. It results in the narrowing of heart or coronary veins, causing obstruction of blood flow to the heart. At times, atherosclerotic plaques may rupture and trigger the formation of blood clot that reduces blood flow and could eventually block off coronary blood vessels in severe cases. Angina. Angina occurs as a pressing discomfort of squeezing pain in the chest when some part of the heart fails to receive enough blood. Such condition is due to the obstruction of blood flow because of narrowed or blocked atherosclerotic coronary veins. Angina can sometimes be felt in the shoulders, arms, neck, or jaws. It may be caused by physical exertion, heavy meals, alcohol consumption, cigarette smoking, emotional stress, and even extra heat or cold. In contrast, when the supply of blood to the part of the heart is completely cut off, heart attack occurs. Typically, more severe and longer-lasting pains are felt that may be accompanied by nausea, sweating, and weakness. However, when a blood clot blocks an artery going to the brain, or in worst cases, when such artery bursts, a stroke occurs. Severe cases of heart attack and stroke can cause sudden death. Cardiac arrhythmia. It is characterized by abnormally high or abnormally low heart rate. Extreme fluctuations of heart rate can result in increased palpitations of the heart with associated dizziness. In severe abnormal cases, the critical condition could impair blood flow and may initiate heart attack. Hypertension or high blood pressure often results from arteriosclerosis or atherosclerosis. This is because of the extra energy or build-up of pressure to make blood circulate in narrowed blood vessels. Studies indicate that the higher the blood pressure, the greater is the risk of coronary diseases, such as ischemic heart disease and stroke. Since the occurrence of hypertension increases with advancing age, lifetime risk of hypertension has become an important medical and public health concern. Anemia and leukemia. Anemia and leukemia are two well-known diseases of the blood. Paleness, weakness, fatigue, and weight loss are among the signs and symptoms that may be observed in both diseases. Diagnostic Diagnostic tests in these blood diseases include complete blood test and bone marrow biopsy, among others. Anemia occurs when the blood does not have enough red blood cells or is deficient in hemoglobin, the oxygen-carrying pigment in red blood cells. The most common type of anemia is the inability to form hemoglobin due to deficiency in iron, vitamin B12, and folic acid. Thus, for its prevention, one's healthy diet must include foods rich in these vitamins and minerals. Examples of these foods are liver, meat, seafoods, eggs, milk, dairy products, fruits, and green leafy vegetables. Leukemia is referred to as cancer of the blood. It is a condition characterized by excessive production of abnormal white blood cells. It starts in the bone marrow when spread out of the body parts. Following are symptoms of leukemia: easy bruising or bleeding, swollen gums, and enlargement of lymph nodes, liver, or spleen. Medical treatment of leukemia varies on the type and stage of the disease. Medical treatments may include chemotherapy, radiation therapy, bone marrow transplant, and surgery. Care of the circulatory system. The circulatory system acts as a transport system to which all other body system depends for nourishment and oxygen supply, as well as excretion of wastes. Thus, to enjoy a healthy life, it is imperative that we take proper care of our circulatory system. The earlier we take extra care of this transport system, the better. Let us practice the following ways of taking proper care of our circulatory system. Eating a healthy diet. This means eating a well-balanced diet that consists of the right kinds of food in the right amount depending on our age, size, and activities. Such foods include those that are high in protein and soluble fibers, and fruits and vegetables that are especially rich in iron and potassium. This circulation healthy diet is low in cholesterol, fats, sugar, and salt. Eating the right amount of food is vital in keeping the circulatory system healthy. Overeating makes us fat and overweight. As mentioned earlier, excess fats are deposited in the inner walls of blood vessels, making them narrow. The heart has to work harder to pump blood through these restricted vessels. Eventually, some circulatory disorders develop. On the other hand, eating too little deprives our body cells of proper nourishment that provides them with energy. The following are findings from observational studies on the effect of certain diet on the circulatory system. Fruits and vegetables in the diet help reduce the risk of heart disease. Garlic, onion, and red chili peppers act as anticoagulant and lower blood pressure and cholesterol level. An unhealthy diet high in fats and cholesterol impairs blood circulation and increases the risk of heart attack or stroke. High-density lipoprotein, or HDL, can reduce a blockage in arteries, while low-density lipoprotein, or LDL, can cause blockage in arteries. Why do you think HDL is called good cholesterol, while LDL is known as bad cholesterol? A low-fat diet with plenty of fiber, such as whole grain, rice, bread, and pasta, has been known to reduce blood pressure. Dietary approach to stop hypertension, or DASH. Eating plan includes lots of fruits and vegetables, low dietary products, and food with reduced salt but rich in potassium and calcium content. Doing regular exercise. When we exercise, our heart beats faster to allow more blood supply into our muscle. This means additional nourishment and oxygen supply that provide more energy to our body cells. A 30-minute exercise on most days of the week is sufficient to reduce stress and risk of circulatory disorders. This exercise need not to be strenuous. Simple physical activities such as doing household chores, taking the stairs, gardening, and brisk walking are beneficial to our circulatory system. Avoiding risk factors. There are factors that may cause circulatory problems. Some of these risk factors are uncontrollable, such as age and family history. However, controllable risk factors can be managed and reduced to prevent diseases of the circulatory system. This includes smoking, alcohol consumption, poor nutrition, tension or stress, and physical inactivity, as well as unhealthy conditions such as hypertension, diabetes, and obesity. Maintaining a healthy weight. Obesity or excessive weight leads to increased chances of circulatory problems like hypertension, high cholesterol level, and diabetes. Even small efforts in reducing weight can be of utmost help. Weight loss by just 10% of our body weight can decrease our blood pressure, lower our cholesterol level, and lessen our risk of developing diabetes. Getting regular health screenings. Regular health screenings provide an index for the appropriate action to take in maintaining a healthy circulatory system. Close monitoring of our blood pressure and periodic laboratory tests of our blood cholesterol level and blood sugar, among others, will help in the proper care of the circulatory system.